Hello, and thanks so much for being with us today as we look for solutions to the crisis of Black mothers and their babies dying in America. At 3 to 4 times the rate of non-Black women, and untold many more cases of near-death experiences while giving birth right here in the United States. And the numbers are rising, not going down. I'm Carol Jenkins. I'm president and CEO of the ERA Coalition and the Fund for Women's Equality. We're comprised of some 210 organizations across the country representing millions of people who believe in equality. And that equality, by definition, has to be available to everyone. Our town halls are supported by a generous grant from the Harnish Foundation and its president, Ruth Ann Harnish. For those interested in closed captioning, you'll find at the bottom of your screen, click on the icon that says more. Before we get to our discussion, we will hear from Congresswoman Lauren Underwood of Illinois, who, with Congresswoman Alma Adams, successfully led the Momnibus Act through the House of Representatives. When passed by the Senate, it will provide some cure to this persistent problem. Congresswoman Underwood co-founded and co-chairs the Black Maternal Health Caucus, which elevates the Black maternal health crisis within Congress.
Hi, everybody. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I would like to thank the ERA Coalition for hosting this virtual town hall on Black maternal health and for all your work to fully realize the Equal Rights Amendment and ensure that nobody can be discriminated against because of their sex. As a co-founder and co-chair of the Black Maternal Health Caucus, alongside Congresswoman Alma Adams, I join you in the mission to advance equity for women and families across the United States. As many of you know, our nation has the highest maternal mortality rate of any high-income country, and the majority of these deaths are preventable. The pregnancy-related mortality rate for African Americans is 3 to 4 times higher than the rate for white Americans. And for every death, there are 70 near misses. This crisis is tragic, it's unacceptable, and it's only getting worse. Pregnant people with COVID-19 are at greater risk for severe illness from the virus and for adverse birth outcomes. To protect Black birthing people during this pandemic and beyond, we need to take bold, evidence-based action. And that's why last year, I introduced a sweeping legislative package to address our nation's maternal mortality crisis, the Black Maternal Health Momnibus Act, which includes 12 bills that build on existing legislation to comprehensively address every driver of maternal mortality, morbidity, and disparities in America. The legislation includes investments to grow and diversify the perinatal workforce, address social determinants of health, improve data collection, provide funding to community-based organizations, and support moms with mental health conditions and substance use disorders. These are necessary investments that will save lives and end disparities. I was proud to introduce the Momnibus with then Senator, now Vice President Kamala Harris in 2020, and I am thrilled to be partnering with her now to move these priorities forward. And in recent months, we've seen historic progress. In November, I was honored to go to the White House to watch President Biden sign my Protecting Moms Who Served Act into law, the first bill in the Momnibus to be enacted and an unprecedented investment to improve maternal health outcomes among veterans. Shortly after the bill was signed, a report was released that showed how some Department of Veterans Affairs medical centers have critical maternity care workforce shortages, an issue that is directly addressed by my bill. Thanks to the Protecting Moms Who Served Act becoming law, pregnant veterans in every VA medical center will now have access to the care and resources they have earned. And on the very same day that my bill became law, the House of Representatives passed another Momnibus bill with unanimous bipartisan support, the Maternal Vaccination Act, which provides funding for a maternal vaccination awareness and equity campaign to protect moms and babies against preventable diseases. On top of these milestones, every single eligible provision of the Momnibus was included in the Build Back Better Act that passed the House, the largest investment in history to save moms' lives and advance birth equity across the United States. As negotiations on the Build Back Better Act continue in the Senate, it is essential that we prioritize these investments that families are counting on. Thank you for everything you're doing to elevate this important issue and to ensure that Black women and birthing people receive the care they need and deserve. I look forward to the day I can be with you in person, but until then, I hope you take good care of yourselves and have a successful town hall.
I want to thank Congresswoman Underwood so much for participating in today's gathering, and also to thank her for such terrific work. Mercury is a little bit retrograde, so we're having a little bit of difficulty with our signals, but so far not so much. Thank you again for joining us today. I do want to now introduce Linda Villarrosa, who is a contributing writer to the New York Times Magazine. Her groundbreaking 2018 story on infant and maternal mortality among Black mothers and babies was a finalist for the National Magazine Award. Her book, Under the Skin, The Hidden Toll of Racism on American Lives and on the Health of Our Nation, will be published in June by Doubleday. And Breana Lipscomb is the Senior Advisor of Maternal Health and Rights for the Center for Reproductive Rights. She has over 15 years of public health experience, and her current role develops advocacy strategies to advance Black maternal health equity through state and federal policies. Breana serves as the co-chair of the board of directors for the Black Mamas Matter Alliance, and she was recognized for the inaugural Kira Johnson Advocate of the Year by March for Moms in 2020, an award named for a guest who will be joining us shortly, we do believe. Linda, I want to start with you, because I was there reading the New York Times cover story, reading about Black women dying in America and in some cities at astronomical rates. Talk to us a little, set the stage for us of where we are now, that we're like several years now. And as we said in the opening, the rates don't seem to be going down. In fact, they seem to be rising.
Well, thank you, everyone, for showing up today. It's really meaningful. And thank you, Carol, for inviting me. Breana, I've loved sharing Zoom time with you. Well, I think for me is when I first heard that rates of women dying or almost dying in childbirth were higher than any other developed nation and going up, I didn't believe it. And I didn't think it was a real issue here. I had to be convinced by someone who worked in Breana's old job, was a friend of mine, and she kept saying, no, this research is out there. But I kept pushing back. And I was like, definitely, this cannot be a problem in America, where we have the best, at least the most expensive healthcare. We are, this totally rich country. We have a lot of clinical, technical innovations in health. So it was hard to believe. But when she gave the rates of Black women dying 3 to 4 times more often, I still was like, well, where is that? And then my friend said to me, did you know that a Black woman with a master's degree is more likely to die or almost die than a white woman with an 8th grade education? And then she turned to me and she said, don't you have a master's degree? And it turns out, yes. And I also had a low birth weight baby myself. And so I started thinking about it and, following it, reporting on it, really, trying to make sense of it. I think a lot of us journalists and journalists, activists, policymakers, like Congresswoman Underwood, have put energy toward this. But I think sometimes the energy goes in the wrong direction. So, for example, in California, this was a few years ago, between 2006 and 2013, they really did a lot of great work trying to lower the rate of maternal mortality by mostly changing what was going on in hospitals. So saying, oh my God, when there's a crisis in the hospital, like what happened to the woman who was the center of my story, who had a hemorrhage, we don't have a toolkit where we have all the equipment right on hand. We don't have the latest, we're not all thinking in tandem. So it's chaotic when something terrible happens or when someone needs an emergency C-section. So they fixed it. They really did. They worked really hard to change the way hospitals functioned when in the event of an emergency. And it worked. The rate of women who died or, in childbirth dropped by 55% in the time period that was studied. But the difference between the higher rate in Black women, 3 to 4 times more likely, didn't change. So then they realized that we can't doctor our way out of this situation. There has to be the realization that this is beyond what we can do clinically and technically, but this is an issue not about race, but about racism and discrimination, both in society and in the healthcare system. And I think that is the harder problem to address. But it's also the most important problem to face. And some of the Momnibus bill does have an equity lens, and the work that many of us do has an equity lens, but it all work around this issue. And infant mortality is connected to maternal mortality. It's just one woman's body having, either she isn't harmed or her baby is harmed, or both. And so we have to think about how does race and racism, how do they play into this?
Right, racism and also place too. Breana, you work in the South, and I'm from Alabama, and I know that you went to school there, or work out of Atlanta now. The South is, if we look at those numbers, they're just so totally outrageous. Talk to us about the difference geographically, as you see it as well.
Absolutely. And first, thank you for inviting me to be part of this really important discussion. You're absolutely right, Carol. The rates that we see in the South, the maternal mortality rates, are often higher than anywhere else in the country. The racial disparities are often wider than anywhere else in the country. And yet there seems to be some of the least amount of political will to address that. Right now, I think for those of us that have been following, the Supreme Court arguments and things like that have happened over the past couple of months, we've seen the abortion bans that have passed in Texas and in Mississippi, and we're fighting for rights to access reproductive health, at the same time that we see states in the South that have the greatest number of abortion restrictions, they also tend to have the least number of supportive maternal health policies. So we can't get general Medicaid expansion. We're fighting to extend coverage to just 1 year after postpartum. There seems to be no will to support paid leave or affordable childcare or expanding access to other social safety net type programs. And that's incredibly frustrating for me as an advocate, but also for the families that are seeking help and seeking access to safe and respectful care. We also see in the South some of the worst provider shortages. As you mentioned, I'm based in Atlanta. In Georgia, half of our counties don't have an obstetric provider. Our rural hospitals are closing at rapid rates. And so just simple access to prenatal care and maternity care is often hard to come by in areas of the state. And we see that not just in Georgia, but across the South and in other states across the country, many of which have rural settings. And so it's been really challenging to fight back against this notion that, as Linda alluded to, that it's just something we can fix in clinical settings or in hospitals. We really have to look at the system and what are the structures in place that have created this infrastructure of barriers, particularly for birthing people of color, when it comes to having a safe outcome to a pregnancy.
Yeah, well, I live in New York City, and I shared, with you the story of all three of my grandchildren, now a 12-year-old and 8-year-old twins. And I have a late friend who started the Jane Crow Project. Her name was Rita Henley Jensen, not a Black woman, but who had come across some of these statistics and said to me, as I began to have grandchildren, I'm going with you to the hospital, because you need somebody to protect you. And I was like, oh, you've got to be kidding. That's not. And if I had not had her in all three births, all three children wound up in the ICU, and my daughter as well with difficulty, I don't know. And she was the one who knew what questions to ask, where is the so-and-so? When is this doctor coming? Because when these horrific stories Hi, Charles. I see you've joined us. Thank you. Thank you so much. I'm talking about my experience as a grandmother, and I know that you have done such terrific work, your experience as a husband and a father. This is Charles Johnson, who tragically lost his wife, Kira Johnson, after a routine C-section at Cedars-Sinai Hospital. Kira was allowed to bleed internally for more than 10 hours before medical staff at the hospital took action. And after her death, Charles founded For Kira for Moms to advocate for improved maternal health policies and regulations to educate the public about the impact of maternal mortality in communities. And I think that's an essential part I want to talk about, not just, the sort of urban areas, but right in the neighborhoods and, that work needs to be done. The work that they're doing is providing peer support to the victim's family and friends, and promote the idea that maternal mortality should be viewed as a human rights issue. Charles, thanks so much for joining us. And I see that you're driving. Can you talk with us?
Of course.
Now, to share your experience.
Sure. So first, let me say, one of the things that I've been very intentional about with sharing my story and my journey is transparency. And so this right here is as transparent as it gets. This is a single father who is dealing with myself and two boys having COVID, literally running the boys to a neighbor's house who also has COVID so I could be here with y'all and spend some time, because this is so important. And I'm so honored to be a part of this discussion with, some of my sheroes. And I'm just appreciative for all of the work that you all do individually and collectively for this movement. And so I will share briefly my experience and what's brought me to this place in this space. And kind of, because I want to make sure that we leave time for what I know is just going to continue to be an amazingly fruitful discussion. But as was mentioned, I like I say, time and time again, I met a woman that absolutely changed my life, right? And so when we talk about my wife, Kira, talking about literally the closest thing that I'd ever met to a superhero. Woman who spoke 5 languages, who flew planes, who traveled the world. And I apologize for these sounds from my car as I pull into a parking space so we can chat. And, we walked into Cedars-Sinai on April 12th, 2016, for what we expected to be the happiest day of our lives, and walked straight into a nightmare. Throughout Kira's entire pregnancy, she was perfectly healthy. All signs pointed to her and our son being perfectly healthy as well. It was supposed to be a routine scheduled C-section. And what happened after my son was born was the most, still to this day, 5 years later, the most egregious set of negligence and policy failures and procedure failures. But most importantly, I want everybody to understand failure of humanity that you can imagine, right? And, Kira was allowed to bleed and suffer needlessly for more than 10 hours while myself and my family begged for the staff to just simply do the bare minimum, simply take her back for a CT scan, simply take her back to surgery. And we were told that the CT scan was coming hour after hour after hour. We were told that maybe they take her back for surgery and they'd have to check with somebody else. And by the time they did, it was too late. And so when I walked into that hospital on that afternoon, the thought that Kira would not walk out to raise her boys, it never crossed my mind. And, the days turned into weeks. I began to do the research and find out what all of us know here. And that's that we have this maternal mortality crisis that's shameful, not only domestically, but, as well as how we stack up against other countries. And so for me, there's nothing that we can do to bring Kira back, but I'm dedicated, as long as I'm breathing, I'm going to do everything that I can to make sure that we honor her in the best way possible. And that's to do everything we can to send other mothers home with their precious babies.
Quite a story. And thank you so much for sharing it, for the work that you continue to do. Linda, Charles is saying this is a question of humanity. Isn't it also a question of training Isn't this the hospital? Is this, I asked you all to think about the levels of either neglect or outright, purposeful damage that's done in these cases. How do you describe, and you've been in this situation too, where you cannot believe your eyes of what you see in terms of the ignoring of someone's pain and distress?
Well, I think, I'm a journalist and I'm really, first of all, Charles, thank you for sharing that story. It's like, I know, and it's heartbreaking. But I think the best way I can think about it is I got a note this morning from a doctor. I get this a lot because of my work and because talking in public, and people, know I'm a journalist, not a doctor. So it was curse out. Okay. How dare you say I'm racist? And I get that, like, I'm going to say once a week, somebody. And I don't think we're saying individual providers are racist. That is not good. That's not good. That's not what we're trying to do. What we're trying to say is something is wrong with a system that lets this happen. Something is wrong with a country where whatever the lived experience of being a Black person or the lived experience about being discriminated against hurts your body. Like if a hemorrhage isn't a normal way to be. And, this isn't normal. It's not normal for someone like me to have low birth weight children. It's not normal for what happened to Carol's grandchildren. And so, but if the lived experience of being a Black woman in America is causing some kind of harm, we have to figure that out. And then secondly, and easier, is to say, we're not accusing individual physicians of being racist, but we are saying that being raised in a country like this, you have implicit bias, no matter who you are. And we have to admit we have that. It happens with, whatever job you're in, including being a doctor, including being a nurse. And so that is the problem. It isn't the doctors who vow to do no harm are going like, oh, let me do some harm. It's like, they don't know. You don't know, but what the research shows is most doctors are super highly well educated. They have, more privilege than the average person, but they're often dealing with patients who are not like them, racially, culturally, education-wise. And so anybody who's uncomfortable with, the person, that's why you don't listen to the person. In my case with, in the story I did, the woman was Black. She was, she didn't graduate from high school, but she knew a lot about her body. She had lost a baby. She knew about her experience, and I watched her being mistreated. Plus I was there and a doula was there. We saw, but all three of us were Black. No one else in the room was Black except us. And so
Breana, yeah. So Breana, you dwell in the policy world, trying to change the overarching mechanisms that run hospitals, that run, this system, and who let this become a crisis. What do you see? I mean, will the momnibus, and let's hope it gets through, the Senate. I know some pieces have made it through. Kira's, bill is there. Congratulations, Charles, for that work. And congratulations, Breana, for being the inaugural, recipient, of that. But take us through the levels of what you've seen the issues are in this country.
Absolutely. And that's a very complex question, so I'm going to try my best to give a succinct answer. Before I do that, I also want to build off what Linda was talking about with the training, is that I've seen, this big push for the implicit bias training, which we do need, but I think it's important for us to talk about it as one component. As Linda alluded to, I mean, it's about the culture of our healthcare system. That's what we need to be trying to impact. And that's going to require training at multiple levels, not just currently practicing physicians and nurses, but what does it look like in their actual course of education in medical schools and nursing schools? It's not just a one-stop shop. We all know how we respond to cultural competency training within our organizations over the past last decade or so, you attend the one class and then suddenly you're culturally competent. That's not how it works. And so we have to think about what's real training. How are we shifting the culture of the way that we provide medical care? And so then, Carol, I think the second piece of that is kind of, and I think it's what the Momnibus does so well, is that it creates this comprehensive roadmap to how we can advance maternal health equity. It's got the piece around implicit bias training, but it also has a critical piece about how we need to expand what we consider the maternal health workforce. It talks about investing more in midwives and in doulas. It's important for Black women to see themselves in the care that they're receiving. And so thinking about how we diversify the maternal health workforce is a critical component of that. Other key aspects of the Momnibus include addressing issues around access to vaccines. We know the COVID-19 pandemic hit Black communities and Indigenous communities particularly hard, and especially for birthing people. We're exploring how to impact climate change. And I think that the climate change issue is another one of those underlying infrastructure needs that is impacting our health outcomes that no one wants to talk about. And so I think that there's a lot of opportunities as part of the Momnibus. And if for some reason our fingers are still crossed that the Build Back Better Act gets over the finish line, and that Build Back Better Act includes as many Momnibus provisions as it can. But if that doesn't pass, we still have the Momnibus, and we will continue to fight for it because it's critical. And so I think that we have the access to care issues. We want to make sure people have access to health insurance, but also their providers if they need. We need to make sure that there's adequate training that's making our providers respond to us and to our needs. That's critically important. And then I think we also have to figure out the data component. For too long, I think we've only focused on data that highlighted problems like, well, she was overweight, she didn't access prenatal care, she didn't, instead of looking at the underlying causes that may have led to some of those decisions, that may have prevented access to care. How do we address those things? And so I'm excited and I'm hopeful about the Momnibus and also other state level actions that get us to this comprehensive approach to maternal health policy.
Charles, did you want to add anything to that? You're working in the community, peer-to-peer, dealing with the families as well as, so that there's that whole story, that is seldom addressed. I don't hear that, what happened to the children? What happened to the husband? And you're here to tell that story.
Yeah. And this makes me emotional thinking about it. And that's really what keeps me going, honestly, Carol. I think that understanding that this is so much bigger than simply Kira's story. This is so much bigger than Shaeza Washington. This is so much bigger than, Amber Rose Isaac. This is a crisis that is affecting families in ways, and these ripples in the pond. We talk about the data, but there's so many aspects of this crisis that we can't quantify, right? Because one thing that I can tell you above all else is that there's nothing that can replace mothers, nothing, right? And so from a father's standpoint, or whether it's a father that has to fill the gap, whether it's a grandparent, whether it's extended family, there's nothing that can do it. And so it's important that as we are fighting to make sure that we protect and we save mothers, it's also important that we center these experiences of these families and make sure that they have the resources that they need to put the pieces back together, right? And that goes from everything from making sure that they have the counseling, the emotional support that they need, to making sure in certain states that there's tort reform. Even in the state of California, right? There are major obstructions to families even getting civil justice and transparency that disproportionately affect Black and brown people and women of color. For instance, and it's even virtually impossible to seek civil justice in the state of California because there's a
the value of human life is $250,000 in instances of medical malpractice and negligence. So people don't even get a chance to, to take their case to trial. Then you have situations where you have medical boards that are corrupt, and not holding physicians accountable. Let me be clear, I'm not anti-physician, I'm not anti-provider, but I am anti-bias provider. I am anti-racist provider. I am anti- racist system. And so we have to take, I think the biggest thing that Breana said is it's a comprehensive approach. It is going to take the policy, it's going to take the stakeholders, it's going to take the providers, it's going to take survivors and patient advocates coming to the table in meaningful ways to make sure that we're able, sooner than later, to talk about this crisis in the historical context.
Linda, I'm so interested in your book coming out in June, Under the Skin, because it's not just Black maternal health, although that is a huge piece of it, but it is, since the earliest days, where, really cruel and brutal experiments and surgeries were carried out on Black women, and experiments or lack of treatment for Black men, the Tuskegee syphilis, experiment there that killed so many people. Talk to us about that. You think you're saying that this racism is what is killing us, not so much these instances, although that is the final piece of it, but it's underlying racism that is killing Black Americans.
I think the reason I wanted to write the book, in the back of my head, and I didn't even realize this until later, was because I've been looking at Black health for 30 years. And at each role, at each turning point, it was sort of like blame the person. So it's either something wrong with Black people's bodies. That's why there's racial health disparities in everything, in almost every kind of illness, there's a racial health disparity. That means that Black people live quicker, die sicker. And then it, all the way through COVID. So when COVID first happened, it was sort of like you saw these, Black folks dying more often and younger. And then it was right away, it was like, well, something's wrong. It's maybe genetic, something's wrong, or it's maybe something you're doing wrong. But then the maternal health crisis shows that even education and access to healthcare, and you have your Serena Williams, your Kira Johnson, you're me, you're the people. We still can have a poor birth outcome, even when things are equal. And so then it can't just be, oh, you're poor, you're uneducated, you're this, you're that. And, so I started looking at that kind of data to say, well, the things we know there's inequality in, the South, but New York City has some of the highest maternal mortality, racial health disparity, even though we have the best hospitals, because it's about inequality. So my book looks at those issues over all kinds of mental health, COVID, maternal and infant mortality, 2 chapters about that. It goes all the way back to what you're talking about is, our experience during enslavement and how, medical experimentation and through lines to the present that came from the past. So it's, it was a lot of work.
Right.
But I'll put a link to the book, but it comes out in June.
I know, and some of are you covering the theory that our absolute DNA has been altered by racism? Do you go that far in your book?
Not as much, but I'm working on a story for the Times Magazine about that now.
About that, great. Breana, of course, the media, reporters like Linda and storytellers like Linda are essential to get the word out and to make change for both Breana and Charles in terms of, what is it that you want people to know? What can they do? How do we come to some, steps forward in this situation? Breana first, and then Charles.
Sure. Well, similar to how I talked about earlier about this culture shift in how we deliver care, I think that what's been really great over the past few years is seeing this culture shift in how we talk about maternal mortality and maternal death in the media. And I think a lot of that can be attributed to the work that Linda did with her piece. It changed how we view the women that we have lost. The stories are shifting from all of the things that were wrong, or all of the things that person should have done differently, and really shines the light on what's going on in our healthcare system. That these are the encounters, that these are the experiences. And so when the media is able to change how we talk about it, it aids us in the advocacy work that we're trying to do when we're trying to appeal to lawmakers and let them know that it's more than just giving money to hospitals so that they can do a quality improvement initiative, that we need to be investing in our community-based organizations that have been working with birthing people for years, trying to provide support, whether it be emotional, mental, or even physical support. I saw someone dropped in the chat about doulas and how important they are. Absolutely. And yet we are, despite all of the evidence demonstrating that doulas kind of create a protective factor for women in maternity care settings, it has been an uphill battle to get Medicaid and even employer-sponsored insurance plans to cover doula services. And it's important to mention the employer-sponsored plans because, as we already mentioned, for Black women, maternal mortality is pervasive across all income and education levels. And so, you know, thinking about the stories and how we translate that into policy action, I think it's critical for us to think about how we're talking about it, that we're not making this just a Medicaid issue. I know when it comes to the federal government, a lot of our policy asks are geared and centered around how Medicaid is paying for services, but we have to make sure we keep this broader view because not everyone that experiences a maternal death is on Medicaid. And so we need to be thinking about, once again, that comprehensive approach so that we're creating policies that benefit everyone. And then, as I mentioned, we're also seeing this shift in folks wanting to deliver in hospitals to people that want to deliver in community settings. And the data shows that it is safe to have births in birth centers that exist. Also, if it's a low-risk pregnancy, birthing at home is safe, but access to midwives has been so challenging, and our education structure is part of the problem there. And so I think that there are several entry points to policy as it relates to maternal health.
Thanks, Breana. Charles, your thoughts on?
Sure. I just have to say, kind of echo Breana's sentiments. So I think that the role that the media and mass media has played in this has been critical. I think that one of the big things that we've been able to do in partnership with wonderful journalists like Linda is refocus this, and it's the humanization of this, and centering this around, you know, the data is one thing, but like I say, oftentimes when a stack of data lands on your desk, you can turn the page. You might be shocked by it and you might be puzzled by it, but when you look into the eyes and you see this, and you see the story, you hear the impact of what this means to people and how it affects their lives so deeply. I feel like that's one of the things that we've done to really turn the corner. And also what happens, the reality of the situation, and God bless Breana for the work that she does, working and being so immersed in policy in this day and time, because there's so many issues in our country that divide us, right? But the reality of the situation is this is not a women's health issue. This is not a Black women's issue. This is what it truly is a human rights issue. The reality of the situation is that women in this country fundamentally deserve and are entitled to deliver babies, healthy babies, and live to raise them, period. It should be a fundamental human right in our country, and we're falling short. And so to be able to elevate that message and allow people to see it for what it truly is a human rights issue is critically important. And then what we're seeing too is we're seeing this real shift in the level of consciousness and awareness, because the reality of the situation is, even still today, we run into people that aren't even aware that this is happening. But this was something that wasn't even being talked about widely, several years ago. And it's because of these storytelling and being able to elevate these stories into you have to meet people in different places where they are, wherever they receive their information. If it's in the New York Times, it may go past somebody, but when you see it on your favorite drama Wednesday at 9 p.m., it hits home for you, right? We have a major documentary in the Sundance Film Festival this year that's going to be featured, right? And so we're just continuing to chisel away at the public awareness, which then translates into policy pressure, both in the private and public sector. And so it's all part of, like we said, this comprehensive approach to raising awareness and then translating that into substantive change.
Great.
Can I just add something to that really quickly, Carol? And Charles, thank you for bringing that up about meeting people where they are and using multiple different media platforms to share the message. A couple of years ago, I was at a documentary screening, and after the screening, there was a conversation, and a young woman stood up and said, "I didn't even know what I experienced when I was delivering wasn't right." Like, it wasn't until she saw the documentary and someone else in that documentary shared the trauma that they experienced during delivery that she realized something was wrong. She says she felt it, but she just thought that that was a normal part of the process, and it wasn't. And the platform we now have for people to share their stories has really, and I hate to use the word empowered because I hate to think about power coming from elsewhere for people, but I think it has empowered birthing people to really find their voice as it relates to the care that they receive from their providers. We're seeing more people asking questions when they receive care, having a stronger voice and advocating for themselves because they are now hyper aware of what that experience should look like. And I think that if nothing else, the fact that we've been able to accomplish that through these different media streams, I'm hoping is going to change some of the outcomes that we've seen.
Terrific. And speaking of questions, we do have some questions from our audience. You all are so terrific and so informative. Chrissy, are you going to ask the questions for us?
I am. And so we had a really great question from, I'm trying to find it, on the role of sexism and what that plays in all of this as well. So, you know, kind of the two parts of a person's persona is race and sexism overlapping here. And if you all had any thoughts on that.
Well, just really quick. Oh, go ahead, Linda.
No, you.
Okay. Well, I will just talk, especially Charles mentioned human rights. And so the Center for Reproductive Rights is a human rights organization. And I love that he mentioned that. Part of what we talk about is how the impact or the human rights violations that people experience are heightened and multiplied when we have these intersecting forms of discrimination. And so a lot of times when I think about maternal health, we can't just think about it from the perspective of Black people experience this more or Indigenous people experience this more, because there's always this role, this gendered it's gendered racism at the same time, right? And so we know in policies in general that oftentimes women and women's rights falls at the bottom, that it's constantly other people making decisions for us about how we want to use our bodies or whatever the situation is. And so, I don't have a really complex answer to the role of sexism other than we continue to see it as this kind of intersecting form of discrimination that we're facing. And it's racism, it's sexism, it's classism, it's ableism. There are many, many compounding forms of discrimination that contribute to this crisis.
And, those of us who work in the Equal Rights Amendment space say that the Constitution is the issue. If you're looking for the source of the sexism and the racism, the Equal Rights Amendment would do so much for, raising, the burden of sexism and racism that's on the, as one of our advocates says, on our necks, throughout life. Linda, you were going to add something about the sexism piece as well.
Thank you. You did a great job covering that.
Can I add something briefly? I think that when this is, I hope that this is received in the context and the manner that I'm sharing it. But I think for me, when we talk about the role that sexism plays in this movement, I think about my role in this space as a man and understanding my privilege, right? And making sure that I'm always practicing responsible allyship. And for me, I've been so fortunate that Kira's story has been magnified and amplified, and I've been able to share it and have so many opportunities. But it's so important to me when I move forward. I didn't realize this until somebody brought it to my attention when I first began to advocate, that as a man in this space, you have a privilege, and people will listen to this and listen to things and hear them and receive them from you in a way, unfortunately, that oftentimes it may not be received from women. So for me, it's always about making sure that as I go forward, that I'm constantly a student, that I am using that privilege to amplify the work of the women that have been in this space far before I even knew that it was an issue, right? And so I think that that speaks to the way that as a man coming into this space and really being one of the first voices to speak out about this issue on a national platform, the way that it has been received speaks to that fundamental issue of sexism in this space, right? That that me telling a story, me telling my wife's story from my point of view and advocating as a man was received in the way that so many women far before I came to the space have been yelling from the mountaintops, right? Mm-hmm. And so we have to call out and be cognizant of that as we move forward, even, you know, with my advocacy work.
Yeah, Charles, we're so glad you're in that space. And when we were on a prep Zoom, you know, so moving to see you with your boys, you know, taking care of, was it snacks, lunch, whatever, you know, I mean, that, you know, so not only are you carrying on in the advocacy space, but you're carrying on in the fatherhood space. So that is, you know, just wonderful to see. Wonderful. Chrissy, do we have more questions from
we do, actually. We have a note from Eileen in Virginia, here where I am. And she talks about introducing a Black maternal health education bill for providers. It's got a mandatory continuing education units credit to address the issue. And she wanted to know if you all could discuss advocacy strategies to address the lack of political will and anything that you've discovered in your research.
The lack of political will.
Yeah.
Boy, do we have a heavy dose of that. Breana, do you want to? You're up against that every single day. So talk to us.
Every single day. I will say this, I don't have any hard and fast strategies. I think we're constantly trying to adapt and shift and see what might work. I will say this, you know, one thing that was really positive is when the Momnibus Act of 2021 was introduced, we had a lot of states that were interested in kind of replicating it and adapting it to a state level, which was really exciting to see. And so last year in particular, I did a lot of work with state lawmakers adapting the Momnibus to kind of a state context. And so I think that particularly at the state level, building off of what's happening in the federal level, like leveraging those opportunities has been really like a great opportunity. The other thing that we continue to do is leverage what other states are doing. So for example, when Georgia first extended Medicaid coverage in the postpartum period to 6 months, we were the first to do it. And then other states around us quickly surpassed us and extended to 12 months. And so now we've been leveraging that story with our lawmakers in Georgia. Like, hey, now we're behind the ball again. Like we need to get up to speed. And recently our governor said that he's committed to doing so through the budget. And so now we actually need to see that over the finish line. So I think, you know, part of our strategy is constantly trying to leverage what else is happening in the space. It may not be in our state, but how can we leverage success in other states, in Georgia? How can we leverage what's happening at the federal level to make change? But I think, once again, I think the key is to not always go for the easy target. I think for lawmakers, it is incredibly easy for them to put money behind hospital-based initiatives. We really need to be figuring out how we can drive money and support and other resources to our community-based organizations that have been providing support to birthing people for decades and continue to do this work, but they are grossly under-resourced in doing so. And so I think that we have to make sure we're keeping that community-based focus to the policy work that we're doing.
Well, You all are just tremendous. I want to thank you all for such a bracing, informative, and moving discussion. We're going to conclude today with remarks from Congresswoman Alma Adams of North Carolina. Congresswoman Adams is a co-founder of the Black Maternal Health Caucus with Representative Lauren Underwood of Illinois, who opened our program today, as well as the Pro-Choice Caucus, Caucus for Women's Issues, Maternity Care Caucus, and so much other substantial and wonderful work. Her work in Congress includes fighting for the Momnibus Act and the Kira Johnson Act.
Good afternoon. I'm Congresswoman Alma Adams, and I represent North Carolina's 12th Congressional District. As co-chair and co-founder of the Black Maternal Health Caucus and co-lead of the Black Maternal Health Momnibus Act, I want to thank the Equal Rights Amendment Coalition and the Fund for Women's Equality for inviting me to provide remarks on the critically important topic of Black maternal health. During today's town hall, you heard from an amazing panel of experts and advocates sharing why it is vital to address the maternal health equity crisis in America. Our nation is one of only 13 countries in the world where the rate of maternal mortality is worse than it was 25 years ago. What is more disturbing is that across the country, Black women from all walks of life, regardless of socioeconomic status and education, are dying from preventable pregnancy-related complications at 3 to 4 times the rate of non-Hispanic white women. About 700 women die each year because of complications in pregnancy and childbirth, and 60% of these deaths are preventable. For me, all of this work began when my daughter, a Black mom herself, survived a complicated pregnancy that almost claimed her life after her complaints of pain in her abdomen were overlooked by her physician. Overlooking the pain of Black women in healthcare results from implicit bias and racism, and higher amounts of implicit bias result in lower quality of care. Research also suggests that the cumulative stress of racism and sexism undermines Black women's health, making them more vulnerable to complications that endanger their lives and the lives of their infants. This is a crisis that demands urgent attention and serious action to save the lives of Black mothers, women of color, and other marginalized women across the country. This is why Congresswoman Underwood and I introduced the Black Maternal Health Momnibus Act. The Momnibus builds upon existing maternal health legislation by filling gaps to comprehensively address every dimension of the maternal health crisis in America to save lives and end racial and ethnic disparities in maternal health outcomes. By investing in social determinants of health, the growth and diversification of the perinatal workforce, improvements in data collection and quality measures, digital tools like telehealth and innovative payment models, the Momnibus package, the first of its kind, intentionally centered Black mothers using the reproductive justice and human rights framework as a guide. Today, you also heard from Charles Johnson of For Kira for Moms, whose late wife, Kira Johnson, is the namesake of my bill and the Kira Johnson Act, a part of the Momnibus package that will provide funding to community-based organizations to support pregnant and postpartum people with maternal mental health conditions and substance use disorders. In the 1966 convention of the Medical Committee for Human Rights, Dr. Martin Luther King Jr. said, "Of all of the forms of inequality, injustice in healthcare is the most shocking and most inhumane." We know that the comprehensive interventions included in the Momnibus can improve health outcomes for mothers while also reducing racial disparities in infant mortality. We know that the Momnibus can save lives because no one should have to lose another friend, auntie, sister, daughter, or mommy to this crisis. It doesn't matter what your political beliefs are. Either you have a mother, are a mother, or you know women who are moms. when we raise the tide for Black women who are amongst the most marginalized and most vulnerable, we ultimately raise the tide for all women. All moms deserve equal access to quality maternal care without bias. Thank you again for inviting me to provide remarks, and let's keep this conversation going. Let's pass the momnibus now, because our mamas cannot wait.
I wanted to say thanks to Congresswoman Laura Underwood, to Alma Adams, to Linda Villarrosa, Breana Lipscomb, and Charles Johnson. You all were just phenomenal. We have to keep this conversation going, as Representative Adams says. And we hope that you all will join us all on January 27th as we rise up for the ERA, celebrating the full force of the ERA, a live stream rally at the White House, delivering our petitions to the Department of Justice. And you'll find details in the chat. Linda, I think, has just put her article up. I think we had it up before, though. And you'll also find information on our website at eracoalition.org. So hope you will go there. Hope you will join us. We will be doing town halls monthly. So we will see you next month. Voting rights next month. I wonder why. Thank you all so much for being with us today. We'll see you the next time.